Hi there, my name is Dr. Holly Hickman, plastic surgeon at Ponte Plastic Surgery, and I'm going to talk about mommy makeovers today. So a mommy makeover just is when we address the changes in the body, whether it is from having babies or whether it's from massive weight loss or just aging. So when the breasts droop or when the breasts atrophy, meaning they're small, when the tummy skin becomes lax, meaning you have excess tummy skin, or you get rectus diastasis, which means the muscles to your abdominal wall have separated. So then you have this unusual pooch. Even when you're thin, you can get that. Well, I have little girls that work out like crazy, and when they do their push-ups, they say they have this little central bulge, and that's when the muscles are separated. So with that requires an abdominoplasty to fix that. That's when we go in, pull all that excess skin down, sew those muscles back together. So it's like a corset, so it also redefines your waistline. A final incision around the umbilicus, it's still your own belly button, it's just got new skin around it, and then we take off at the lower abdomen the excess skin. The breast, that may be a breast augmentation, it may be a breast reduction, or it may be a breast lift. Anything to address the breast combined with the abdomen then makes an abdominoplasty. So with the breast reduction, we reduce the breast tissue and lift the nipple areolar complex. And then with a breast lift or a mastopexy, there's several different kinds just depending on how much of a droop, or a ptosis is the medical word for sag, that you have on what kind of incision. It may just be around the areola, it may be around the areola and down, which is the vertical or the lollipop lift, or it may be a wise pattern, which is around the areola down and under, depending on the degree of sag that you have. Then a lot of times that's combined with liposuction. A lot of times when we start to get when we've had several children, our hormones start changing, we become perimenopausal, we start getting a male fat distribution, which means fat on the sides, your flanks, your kind of posterior flanks that you normally wouldn't have. So when you're in your 20s and 30s and your hormones are strong, you get a curvy little waistline. Then as you start aging, you start depositing fat kind of just on that upper waist. And so a lot of times we combine the abdominoplasty with some flank and some side, kind of outer thigh liposuction in that whole area, just to shape you up a little bit. Sometimes we do outer thigh and inner thigh liposuction with that. A lot of times patients, as we age, we get these weird kind of little blobs under our arms that makes it look like you've just got some kind of extra breast out here, and we'll do some anterior axillal liposuction to just kind of reshape the breast a little bit. So all of things combined can be what's called a mommy makeover. So in order to figure out what would fit you best, if you're someone who needs this, then that would be a consult. Feel free to look us up at pvps.com if you'd like to hear more about a mommy makeover. We look forward to hearing you. Hope this was helpful. Thanks so much for your time.